Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider. Welcome back, everybody, to another episode of Explain This. I'm back with the star of the show, Robin Riddle. Robin, how are you?
I'm doing great. How are you?
I'm doing wonderful. I'm excited about this episode because I know it's going to help so many people. And, women's hormones has become a hot topic with, they've lifted the black label. Is it the black label? Is that
Yes.
what they call it?
Black box.
The black
Black
box,
box.
the black box, black label. If you're naive, Ben, the black box warning on estrogen. So we're excited about women's hormones. We're going to talk about it today. Robin's going to explain all the different options out there.
Yeah,
Perfect timing.
absolutely. Yeah. So, yes, I'm super pumped that the FDA has finally gotten on board and realized that hormones don't cause cancer. And so, in doing that, we're getting a lot more patients who are finally like, okay, I've been interested, but I've been scared. I'm more comfortable now. What can we do? And so, I have this conversation probably daily
I
with
bet.
new patients coming in, where I like to go through and list all of your options.
Okay.
I definitely have routes that I use more often and replacements that I like better, but I like patients to know everything that's out there. And
Okay.
there are a lot of options on the market.
Okay.
So being in a hormone replacement clinic, being more functionally minded, we do tend to use more compounded products. But I do know some patients, like we have patients come in that are a little bit uncomfortable with compounds. They've read, okay, well, with compounds, it might not be well regulated. You don't necessarily know what you're getting. Or their OBGYN will tell them, like, hey, don't go on anything compounded. Now, I will say when you use a good compounding pharmacy, a compounder that you trust, someone that knows what they're doing, somebody that sends their things out for testing, you're getting good quality products. Don't just use some Joe Schmo off the street that just popped up. Like we use set places that we know and trust.
Right.
So we're very confident in our compounded products. But if patients want to know other options, there's a lot out there. Hormone replacement therapy is definitely not a one size fits all for women. So we look at all the options. Of course, your compounds are going to be easily customized to fit like the patient's exact needs, and we can tailor it very easily based on patient's response. Whereas your commercially available options are going to be more set dosing, and you just have to work within the confines of what you have. But commercially available is more likely to be covered by insurance. There are FDA approved products for hormone replacement therapy that can be covered with insurance. So when we're looking at cost, it is going to be less expensive than your compounded products would be.
Okay.
So we'll review commercially available options first. So when we're looking at hormones, we're looking at replacing estrogen, progesterone, and testosterone are the three that we're talking about. So estrogen is, when we're looking commercially available, it's estradiol, which is your more potent form of estrogen.
Okay.
So from commercially available products, it's only estradiol that they have. So first up on the list is going to be oral estradiol. Brand name is Estrace. This is one that most people have probably heard about. I see OBGYNs use this all the time. Primary cares use this all the time. Personally, this is my absolute least favorite way to replace estrogen. And if patients come to me on an oral estrogen, I'm probably going to talk them into changing it because of a couple things. Oral dosing, we have more burden on the liver. So you go through something called first pass effect. So when you take this orally, it hits the liver has to metabolize this and like basically package it up to send it out for the body to use it.
Okay.
So you go through what's called phase 1 and phase 2 detox in the liver. If that's kind of sluggish, then this oral estrogen can be increasing systemic inflammation, and we can end up with some estrogen dominance type symptoms. So like breast tenderness, moodiness, irritability, that kind of stuff. Oral is more likely to produce toxic estrogen metabolites. So when the body breaks this down, we want it to become something called 2-OH. That's a healthy metabolite. But again, when we are taking this orally and it has to process through the liver, it can become 4-OH, which causes some DNA damage, or 16-OH, that is more likely to have impact on breast and uterine tissue. So we really don't want to go down those pathways. And unless we do testing, like a Dutch test or something like that, to know that patients are metabolizing this correctly, I'm more likely just to pull them off the oral altogether, knowing these risks are there. Oral estrogen can also increase your something called sex hormone binding globulin, which then binds to your testosterone and lowers your free testosterone. So we can actually cause like low libido, low energy muscle loss by taking an oral estrogen.
Okay. And this is all commercial?
This is all, this is that commercially available estrace or oral estradiol. Now, technically, compounding pharmacies can compound oral estrogen as well, so this applies both ways. Just oral estrogen in general is kind of a no-go for me.
Okay.
Increased clotting risks, and then again, it's harder on women who can't methylate or break it down well.
Okay.
The next product commercially available is called Bijuvia, and it's a combo estrogen and progesterone in one pill. So it's still your bioidenticals. All of these are bioidentical that I'm talking about. All of these are estradiol and progesterone, not progestins. So the Bijuvia has its oral estrogen, oral progesterone combined into one pill. Again, it's set dosing, and again, it's oral estrogen, which is not my preferred, but it's available. It's out there. We then move in, we can do estradiol patches. So if we're doing something commercially available, estradiol patch is really what I lean towards. It's this tiny little patch that's applied to like the lower abdomen area. You switch it out twice a week and we get that steady transdermal absorption of estrogen. So as far as commercially available products go, this one's probably my favorite. Very safe dosing route, good results with it. They make an estradiol gel that can be applied to the skin. They make an estradiol spray that can be sprayed on the skin. This one, I had no idea. I've never seen it before. But it's out there.
You said we're going to go over all the options.
Go over all of them. Can't say insurance will necessarily cover that one, but it's out there. Okay. Estradiol injections. So this is not something that we do really ever in our practice, but there could be a place for it. It's kind of like doing testosterone injections. You do it once or twice weekly. So there is the option for estradiol injections. Okay. And then they make lots of different versions of intravaginal estrogen. So lower doses are going to be more effective just for topical like relief just in the area. High doses actually can go systemic and give relief for menopause symptoms and things like that if dosed to higher levels. Okay. The big thing with this is a lot of times it's creams and they're messy. Nobody wants to deal with that every single day for the rest of their life. So not my preferred, but it is something that's an option.
Okay.
Then when we look at progesterone products that are available commercially, we have Prometrium, which is oral micronized progesterone. This is the only commercially available product that is bioidentical. So there's other ones that have the name progesterone in them. They are not bioidentical. So like medroxyprogesterone, not bioidentical. That is synthetic. Doesn't matter that it says progesterone in the name. It's not actual bioidentical progesterone. Okay. So the only bioidentical commercially available product is progesterone or Prometrium. Comes in 100 or 200 milligram capsules, only available in an immediate release. I did a whole video on this one, which we can link, explaining the differences between compounded and commercially available progesterone. If we're looking for, again, cost effective, a lot of people can handle the commercially available. And just to address, I know I talked about how to not do oral estrogen, but oral progesterone is different. So it also does go through the liver. It does hit that first pass effect, but going through the liver and being metabolized is what actually makes it beneficial. So the metabolism in the liver turns it into something called allopregnanolone and pregnenolone. So two different metabolites there. This decreases anxiety, improves GABA levels, calms the nervous system, improves sleep, stabilizes mood, and offers us better endometrial protection than any other dosing route on progesterone.
Okay. And that's it. That's an oral progesterone, and you guys are cool with that.
Yeah,
Okay.
absolutely. So a lot of people are like, oh, well, that comes from Walgreens or that comes from CVS. That's not bioidentical. It is.
Okay.
It's not compounded, so it might not be as clean of a product, but it is bioidentical.
Okay. Okay.
So again, people can watch my whole progesterone video. I explain that a little bit more.
Yep.
And then testosterone. So unfortunately, the FDA has not quite yet recognized the benefit of testosterone for women. And so we do not have any commercially available FDA approved products that are specific to women. So what we are doing is we are using off-label men's products and just trying to dose them down to accommodate female needs.
Interesting. Okay.
So androgel is going to be the most common product that can be used. And so it is a topical testosterone gel that's applied to the skin. The only downside to this is dosing is very arbitrary. Like it's 20 something milligrams per pump. So we'll tell patients, use 1/10 of a pump or 1/4 of a pump. Okay, well, what you think 1/4 of a pump is and what I think 1/4 of a pump is might be different. And you might push it to 1/4 one day and like 1/5 the next day, I have not yet figured out a great way to be very consistent in dosing with this one.
Okay.
So if we're using this androgel product, I tell people we're partially dosing it on labs and partially dosing it on how you feel, how you respond to it.
Okay.
If you start growing a beard, it's probably too much. So back it off. But we can't tell for sure exactly how much you're getting every single day.
Okay.
So that's the downside of that. And then you also have testosterone injections. But again, we're repurposing testosterone that's made for men. So it's 100 milligrams or 200 milligrams per milliliter. And we're just taking teeny, tiny doses of that.
Are those patients doing that weekly like the men are? Or
usually.
Okay.
Yeah. So most of my women, if I'm doing testosterone shots, I tend to go on the low side because women can get really high really fast with this.
Okay.
But I'm usually doing like 5 to possibly 10 milligrams a week.
And for reference, a male is probably going to be the
120
150.
to 200. Yeah. So when your concentration is 200 milligrams per ml and you're trying to take 5 milligrams, you're taking like this much. Like you can barely see it in the syringe. It's a little difficult to actually pull up. But that's what's commercially available.
Okay.
So that's all the things that you could go to a regular pharmacy, Walgreens, CVS, something like that, and get and have the probability of your insurance covering it.
Okay.
So now we'll switch to the compounded products that are available.
Okay.
When it comes to compounding, we can make just about anything that we want to make. There are oils, creams, drops, sublingual, oral capsules, injections, pellets. We literally, if you can think of it, we can probably make it. So lots of products available. I'll focus in on the options that I typically use in the practice and what I usually tell my patients about.
Okay.
So that's going to be a topical compounded cream. We can change the base in it. It could be a gel as well, depending on where it's made. But with the topical compound, we can put whatever hormones we want into that. So we can put your testosterone, your estrogen, all of that can be combined together into this one cream that then is just applied one time a day. The nice thing is we can choose individual dosing. It's very easy to customize. I personally prefer not to put progesterone into the cream because of what we talked about earlier. The oral progesterone, you're going to get more benefits from, but you can put the progesterone into the cream as well. So for people who want absolutely the most simple possible thing that they can do for hormones, put your estrogen, your testosterone, and your progesterone all into a cream. You apply it every day and you're done. So very easy. One cost, one cream, one thing to think about. The pro is topical dosing is known to be extremely safe. It is effective for some patients. The downside is for others, it's not going to absorb as well. I'd say probably 50-50 that I see personally with patients as far as getting good absorption from these topical creams.
Okay.
We do know that the topical creams don't show up as well on blood work, specifically the estrogen portion. We just don't see as much impact on blood work. So if we're looking for good blood work, really seeing good numbers, the topical is probably not the way to go.
Okay.
Then we can do compounded sublingual formulations. These are either called triacetuates, which are really teeny tiny, or mini troches or troches. Biggest one you're going to have is going to be maybe about that big. And it's this little thing that we dissolve under the tongue. So this tends to be one of my favorites because we get pretty rapid results out of this. We can combine the estrogen and testosterone together again in this. So again, one simple thing that we do every day. Sublingual dosing goes through the mucous membranes into the bloodstream directly. So as long as we're dosing this and taking it correctly, we're not going to have a significant impact on the liver. Now, what I tell people is you don't put this in your mouth and suck on it like it's candy. We're not trying to swallow all that hormone. We are trying to let it sit just for a couple minutes and it penetrates through that bloodstream. So we're not chewing it up, swallowing it, anything like that. It does have a slightly shorter half-life. So if some people are extremely sensitive to their ups and downs in their hormone levels, it could require twice daily dosing. But I will tell you, a good majority of my patients in the practice are on sublingual and they, for the most part, love it.
That's so interesting. To be honest with you, I had not heard of that. That's really interesting. It makes a ton of sense from an absorption standpoint.
Yeah. It's a route that I used a lot before I came to performance medicine. So it's not one that performance medicine specifically was using as much.
Right.
We tend to be more creams or pellets. It seems to be the way that Dr. Rogers goes.
Right.
But I like having that in-between option, and the sublingual, I mean, patients do really well with it.
That's so cool. And it seems like it's, in terms of like ease, like that's a very easy one.
Yeah. The pharmacy we're using now, patients have told me they're dissolving even faster. So it goes under the tongue, 2 minutes, it's gone, and you go about your day.
Super cool.
Yeah. We do have pellet therapy is the other option that we offer people. So you do get more steady levels overall with pellets. You will have a build up and a drop off, but it's a longer time frame. So it takes maybe 2 weeks for these to really start to kick in. And then when you get to the end of it, if you haven't gotten your next pellet soon enough, you feel a little bit of a fall off with these. But this is extended over 2 to 3 months. So for those 2 to 3 months, we have very steady, stable levels.
Okay.
For pellet therapy, we only put testosterone and estrogen in there. There is a progesterone pellet available, but again, oral progesterone is going to be your absolute best result, so I'm not going to be doing a progesterone pellet.
Okay.
Only downside is it is a procedure, so very minor pain, very slight recovery with it. It's a teeny tiny incision, so it's not a huge deal, but it is a little bit more invasive.
Right.
Other downside, we can't really control or adjust your levels once they're in. So, if we needed a little bit more, if we started you on a little bit on the lower side or something like that, there's not, you can't just up your dose the next day sort of thing. So we're working more in 2 to 3 month cycles versus being able to tweak that dose daily like you could with a cream or a trit.
Okay.
And some practices do dose pellets way, way, way too high. I've seen it where patients, especially females, will come in with testosterone levels pushing 500 because they told them like, oh, you need this super high dose testosterone pellet. So pellets have got to be done correctly. If you're too aggressive,
you can't adjust, like you said.
You cannot adjust. You're not fishing that thing out. I had a patient come from a different practice and she's like, can you take this out of me? And I'm like, absolutely not. You're not going to find that. You're not fishing it out. And so you can't adjust. So when providers dose patients way too high, those patients are dealing with those symptoms for easily 3 to 4 months before they go back to feeling somewhat normal.
Okay.
So if you're going to get pellets, make sure you do it with a provider who really knows what they're doing with dosing.
Okay. Okay.
I would always rather start patients on the low side and then come back and be like, I didn't feel a ton, but I felt okay, versus doing a high dose and someone coming back and they're like, dude, I felt like a man for the last 3 months. Like, I'm so aggressive and I've got a beard, and like, we don't want to go to that side of things.
That is based on what I've seen on comments on our videos. The beard thing seems to be a very common concern.
Yeah.
Voice lowering, stuff
Yeah.
like that. I do think that's a, a misconception around testosterone with women.
Yeah, I mean, it's a very real thing if you get your levels too high for prolonged periods of time.
Yeah.
Truly, like dropping your voice or those big effects that are not going to go away are usually your women who are pushing it on purpose.
Okay.
Like
Got it.
they're looking for the muscle building, and these are your bodybuilders that they want to have muscles like a man, so they're pushing to much, much higher testosterone levels.
Okay.
Um, but again, if you're doing pellets and it's staying high for months and months and months on end, and you go back and get another one and it's staying high for months and months and months on end, you definitely could develop some symptoms like that.
Okay.
So it's all about dosing and
Okay.
being appropriate in the dosing. We don't want levels that are 300-400s on patients. You're not getting any additional benefit, and you're risking side effects with that.
And this is probably an obvious question, but when you're in a visit with a patient, um, they can switch, right? So, like, say they start one way and they might want to do something else another time. Is that
Yeah.
something you see a lot of, or
Um, Not super frequently. Like
okay,
I do see people switching from like creams to trits. I do that very often. So from
okay,
the creams to the sublingual, I get that a lot. Or patients will want to start out with something like a cream and kind of get themselves used to it and then switch to a pellet,
okay?
just for the ease of it. But once people find the route that they really love, they don't switch around very much.
They're like
Um,
this all day.
Yes, yes, absolutely. But I mean, that's what we're here for. We're super flexible. That's why I give people all these options. If you
Yeah,
want to try a different one every month, go for it. I wouldn't advise it, but like, I'm here to work with you.
yeah.
And so that's what's so nice about having so many options available. Like, we can find something for everyone. And so that brings me to the last compound that we do a lot of, and that's going to be your oral progesterone. So again, we can get this commercially, but when we get this compounded, it's obviously still the bioidentical micronized progesterone. Biggest difference is that we can customize the dose to be anything we want it to be. And we can also make this sustained release, SR. So it hits your system a little bit slower. So for like people with poor sleep, they're more likely to fall asleep, stay asleep through the night,
Oh,
where the IR might wear off during the night and they might be waking up.
okay, okay.
So many options. If you have any type of hormone replacement that you want, we can do it. Um, it's just, again, deciding what combination is right for each patient. It's going to be very individualized. I give every patient all of these options, and then we base it on patients, personal preference, how compliant patients are going to be. If I've got someone that's like, I am never going to remember to do something on the daily, then I'm like, okay, let's not be doing 3 different things daily then. Let's compound it all together, or let's do a pellet and then all you have to remember is your progesterone. So compliance is big. It doesn't work if you don't do it. Um, of course, based on patient symptoms, there are some dosing routes that are going to get you faster effect than others. And then budget too. If patients want to try to stay on within a specific budget, we've got products that can do that.
I was going to ask you around like, okay, you've laid out all these options for a patient. How do people decide? I would imagine you got to know your personality a little bit. You have to
Yeah,
know, how you kind of lean. Because some people are very regimented, and maybe doing something, daily is really good for them because it's
yeah,
part of their routine, and also like some people might not like a procedure,
yeah.
so it's nice to know that there's just a plethora of things that you can do to still get the treatment that you want, the
Yeah.
care that you want.
Yeah, absolutely. So the whole takeaway from that is we've got options. I love patients to know their options before they come see me, so then they can do a little bit of research on it and maybe know which way they're leaning. Because you definitely have the patients that freeze in the room and they're like, wait, like that's so many options.
Yeah.
Yeah, it is. And we have to make a choice. So
Well,
this is a great video to watch before you come see us
yes.
for hormones.
Yes.
Um,
Yeah,
yeah.
we're going to make that we'll have to make that some sort of requirement. Watch this video before you go in with for an initial hormone consult, because
Know your options.
it is a lot. That's a lot
It
of different
is.
options to go through. Robin, this is amazing. A lot of these I had not heard of, and it's comforting to know that, one, hormones can be for most people who need it. It's
Yeah,
not something that's limited. There's lots of different ways to go about it. So thank you for explaining this.
absolutely. Absolutely.
And I think we just found our thumbnail. We've got options.
Here we go. We
All
have
right.
all the
We've
options.
got all the options. All right, guys, you name it. Robin explains it. Robin Riddle, I appreciate you so much.
Absolutely.
All right, guys, we'll see you next time.
Don't go away.